My wife and I have been coming to see Dr. Breida for about 15 years. We use him as our general practitioner. We got to know him because my mother-in-law was a pharmacist here at St. Vincent, so she knew all the doctors here, and he was her favorite endocrinologist. But we use him as our general practitioner. He treated my mother for diabetes when she had cancer, so that was pretty early in our relationship. We got to know him under very serious circumstances, and he took care of her just wonderfully, and he's been great to us all these years. Dr. Breida is different from most doctors because he's a very good listener, and he takes a lot of time to listen to what the patients say, and he also takes a lot of time in his response and his diagnosis. Sometimes he'll think of something days later and give you a call, which is pretty unusual. Dr. Breida is cool because he's really easy to talk to. We feel that we can ask him, any kind of question and not feel nervous around him, and he'll give us a sincere response. I would recommend Dr. Breida to family, friends, and I have. There's a couple of my friends now that see him either as a GP or as their specialist. And these were people who hadn't been real comfortable around their other doctors and didn't like the usual practice of, a lot of doctors reach for the prescription pad first. Dr. Breida reaches for his prescription pad last. He's not a pill pusher. What makes Dr. Breida so special is he's a good listener. He listens to you carefully, and he spends a lot of time listening, and he spends a lot of time with you in formulating his response and diagnosing your problem. Sometimes he'll call you a couple days later if he thinks of something different. I live in West Hills, and that's about an hour drive down here, and I make that drive because Dr. Breida is that good of a doctor.